Good afternoon. I'm Dr. SOTERO Ramos III, here to present my research entitled Functional Outcome of Conservative Management of Isolated Lateral Malleolar Ankle Fractures among patients 20 to 60 years of age in the Philippine Orthopedic Center, a case series study. Isolated lateral malleolus fractures comprise 70% of all ankle fractures. Common mechanisms of injury are fall from standing height and vehicular accidents. Open reduction internal fixation is the treatment of choice, especially for displaced or unstable fractures. Operative management dominates conservative management. However, conservative management is gaining more interest. These are various studies regarding the conservative treatment of isolated lateral malleolus fractures, and overall, they have good clinical outcomes. Dietrich et al. In particular compared the conservative treatment to the surgical treatment of these fractures, and based on the Olerud-Molander ankle scoring system, the conservative treatment gained more favor. Christensen et al. And Hansen et al. Concluded that conservative treatment did not carry any appreciable risk for arthritis. However, no grading scale was used to measure the functional outcome. The AOFA score, or the American Orthopedic Foot and Ankle Scoring System, was developed by Kitaoka et al. In 1994, is the frequently used instrument for assessing outcome after ankle and hindfoot injuries. This is both subjective and objective evaluation of the forefoot, midfoot, and hindfoot. And in this particular study, I made use of the hindfoot scoring system. It is divided into three parameters, namely pain, function, and alignment. And the highest overall score is 100. The higher the values, the better the score, meaning fewer symptoms and higher functioning. So the research question is, what is the functional outcome of patients with isolated lateral malleolar ankle fractures after conservative management based on the AOFA score? The objective is to determine the functional outcome of patients with Weber B isolated lateral malleolar ankle fractures with acceptable reduction after conservative management by means of the AOFA score, and specifically to determine the radiographic measurements of these fractures after conservative management, and to correlate the radiographic measurements with the AOFA score of the patient. For my methodology, this study is a prospective case series study, and I made use of a convenience type of sampling, and my sample size was computed to be 21 at 95% confidence interval using the OpenEpi online application. And in order to increase the power of the study, the sample size was increased to 27. For my patient selection, I included those patients ages 20 to 60 years old with the closed Weber B-type isolated lateral malleolus fracture sustained within 7 days. And my exclusion criteria are as follows. Initial management for these patients, a bilateral ankle radiograph were obtained, and an additional gravity stress view was obtained in order to rule out instability. Medial clear space, talocrural angle, tibiofibular overlap, and tibiofibular clear space were measured before and after reduction, and after which an application of a short leg circular cast was done. Patients were followed up at 4 days, 2nd, 4th, and 6th week after casting, and the measurement of the said parameters were done at every follow-up. Cast out was done on the 6th week post-injury, and patients were referred to rehabilitation for 50% partial weight bearing for 4 weeks and full weight bearing for another 4 weeks. AOFA scoring was done on the 14th week post-injury. This is my demographics table. The age range of the patients are 20 to 60, and in this study, there are more male patients than female, and the more affected extremity is the left ankle. Pre-reduction radiographic measurements of the medial clear space, tibiofibular overlap, tibiofibular clear space, and talocrural angle are as follows. The average AOFA score is 89.03 plus minus 5.4. A one sample t-test was used in order to compare the pre-reduction and post-reduction measurements of the medial clear space, tibiofibular overlap, tibiofibular clear space, and talocrural angle of the affected ankle. And there were no significant differences among the measurements. Likewise, one sample t-test was used in order to compare the measurements of the affected ankle to the contralateral ankle. And this is the table for the medial clear space, tibiofibular overlap, tibiofibular clear space, and talocrural angle. And there were no significant differences among the parameters. A Pearson correlation was used in order to correlate the AOFA score with the radiographic measurements of the affected ankle at 14 weeks when the patient is already in full weight bearing. And there is a weakly negative correlation between the medial clear space, the tibiofibular clear space, and the talocrural angle to the AOFAS, and a weakly positive correlation between the tibiofibular overlap and the AOFA score. So in conclusion, closed stable Weber B isolated lateral malleolus fractures managed conservatively in this study have an AOFA score close to 100 and averaging 89 plus minus 5 in this study. There is a weak correlation between the radiographic measurements with the AOFA score, and reducing the ankle within normal limits will yield to good results. For my recommendations, a longer follow-up period would probably have increased the AOFA score closer to 100, and correlating the radiographic measurements to each parameter of the scoring system might yield different results rather than correlating it to the overall AOFA score. Thank you, and these are my sources.